Hello, everyone. If you're listening to EmpowerRF Master Class, it's because you've probably bought an EmpowerRF platform and you definitely want to know the ins and out and how to use it. I am Dr. Henry Ramirez. I'm the CEO of Southern Oklahoma Women's Health, Azure Med Spa, and Willow Park Med Spa. I'm a cosmetic gynecologist, trained and practiced as a urogynecologist. I have an integrative medicine fellowship. I was an occupational therapist prior to going to medical school. I do a lot of different cosmetic procedure trainings, and I also was the developer of the Aviva Femtite that we'll talk about today. When we think about the opportunity that we have for the EmpowerRF or for all the things that our women are dealing with, we have to really realize that our standard of care in the United States really limits our ability to prevent and take care of our females' pelvic floor dysfunctions. We know from studies that 90% of women that have a vaginal delivery end up with some type of pelvic floor dysfunction. And out of that 90%, a large percent of those patients are being told every day that, there's not much we can do. Be blessed. This is something you'll have to live with. Or you've had a kid, either you deal with your symptoms or you end up having surgery. Or what we've known forever is that if we were to take the time to really understand the type of disruption and injury that a pelvic floor has in a vaginal delivery, we should really be considering that pelvic floor like we consider our athletes when they have injuries. If I'm an athlete and I have, let's say, knee surgery, one of the first things that end up happening is that once I'm done with surgery, or even prior to surgery, we strengthen that muscle so that it can be strong enough to deal with surgery. Then once I'm recovered from surgery, before I get back to any kind of playing field, they're going to make sure that I have full strength as well as full range of motion. Well, I really feel like for our women, for our mothers or sisters or daughters, we should provide the same things. For some reason, majority of the practices in the United States are not providing or educating our patients in stress in pelvic floor dysfunction. So what we're seeing is that 1 in 3 women are suffering from stress incontinence. 76% of those women are decreased vaginal sensation, most commonly with a feeling of a widened vagina. Vaginal atrophy and sexual dysfunction affecting about 50% of our postmenopausal women. Sexual dysfunction is an entire story within itself. We know that patients that end up with sexual dysfunction are more likely to have depression, anxiety, obesity, diabetes, heart disease, and those things. So if we are unable to meet them where they're at and provide something that works, then we're really missing the full picture for these patients. Incontinence affects the lives of almost 400 million people worldwide. The last numbers I saw, they're saying that incontinence is becoming such a big issue in adult age patients that Depends are starting to be sold more than the regular diapers. So this platform it's the first platform that has a solution for all changes female experience during reproduction and aging. It's a new technology that's not invasive to assist prevention, restoration, and optimization of that pelvic floor. Prior to this, as I said before, or the amount of prevention that we had was basically just telling our patients to do their Kegels. But what we know about patients doing Kegels is that most of the times when you injure a muscle, you cannot recruit all the muscles that you've injured. So therefore, they fail in their ability to do Kegels, and therefore the pelvic dysfunction numbers are so high. So with the Empower machine, as I said, it's a technology that's able to treat all the different changes a woman goes through after delivery as well as a woman ages. It has all different types of hand pieces to be able to perform these things. It has a VTone, which we'll go over, Morpheus 8V. It has a FormaV, which is a bipolar radio frequency. It has a regular Morpheus, a Morpheus body, the Aviva, and an abdominal tone. All these hand pieces, again, are to target those areas that patients are changing and also becoming dysfunctional in to restore self-confidence as well as improve quality of life without surgery or prolonged downtimes. So what kind of conditions are we able to really treat significantly with this platform? Number one, urinary incontinence. both stress and urge incontinence. We'll cover that. Stress, sexual dysfunction, depending on the type. Pelvic floor weakness, genital urinary symptoms of menopause or vulvar vaginal atrophy, abdominal wall weakness, changes in aesthetic appearance of the female anatomy and the vulvar, dryness, itchiness, reduced elasticity, burning sensation, recurrent BV as well, recurrent UTIs. So we know that any kind of procedure that we perform is very important to set expectations. I believe that 90%, if not higher, of our success rate comes from our ability to set expectations. In my practice, I absolutely like to underpromise and overdeliver. We use a lot of pictures to illustrate, to make sure those patients see the differences. A lot of time, because we're working in intimate area, private areas, a lot of patients don't even really take the time to look at their vulvar. So most of the patients that ask for a change or a cosmetic change in their vulva are looking. So it's important to have pictures to show the changes. I like to go over the entire procedural plan. There's nothing worse than a patient not having their expectations set and they come in and don't realize that we have to use dummy medication, that they may have a little bit of cramping and all those things. So they need to understand the whole entire procedural plan, as well as their post-operative courses, potential complications, their benefits, the risk, and their alternatives.